The review by Dr. George Musgrave, Goldsmiths University in the UK, and Dr. Dorian Lamis, Emory University School of Medicine in the USA, begins with a worrying pattern many of us have noticed. Musicians, especially famous ones, often seem to die young. Over the years, researchers have tried to explain this by pointing to two main things. First, many musicians struggle with mental health problems. Second, alcohol and drug use is more common in parts of the music world. Some scientists think people who become musicians may already be more emotionally sensitive, which could make mood problems more likely. Others strongly disagree. They argue that musicians are not built differently at all. Instead, it is the job itself that causes harm. Long hours, money worries, constant pressure to perform, time away from home, and easy access to substances can slowly wear people down. Or is it a combination? Stories like the 27 Club have turned these deaths into legends, making it seem as if suffering is just part of being creative. Musgrave and Lamis push back hard against this idea. They argue that this way of thinking is not only wrong, but dangerous. Instead of asking why artists are tortured, they ask a far more important question. Are musicians truly at higher risk of suicide, and what can be done to stop these deaths from happening? To answer this, the authors pull together evidence from public health, psychology, medicine, and music industry research. A key point is that this risk shows up repeatedly across decades and countries. Occupational data going back roughly 80 years, mostly from places like Germany, the US, the UK, and Australia, repeatedly puts musicians in a higher risk group compared with many other jobs, especially for younger musicians. Sometimes musicians are not the very highest risk creative group. Poets and visual artists can look worse in some datasets, but musicians still sit in a heightened risk bracket, alongside other creative workers and even some manual trades. In other words, this is not just a handful of celebrity tragedies, it's a pattern seen in population-level data. The review also widens the lens beyond musicians alone. If the problem were only about famous musician personalities, you wouldn't expect to see similar warning signs among other people working around music. But the authors highlight studies showing very high suicidality in the wider entertainment and music workforce. In one Australian report, lifetime suicidal thoughts were more than 6 times higher in entertainment professionals than in the general population. In the US, research on touring professionals and artists found suicidality more than 5 times higher than the general population, using a standard measure, the Suicidal Behaviours Questionnaire Revised. That makes the "it's the working conditions" argument feel much harder to ignore. One of the most striking findings is about gender. In the general population, men die by suicide more often than women, but musicians don't follow the usual script. Data show women musicians have elevated suicide rates compared with other women. Suicide risk also seems to differ by music genre. Studies suggest it is lowest among gospel musicians, possibly because faith and community can be protective. Higher rates have been reported in genres like punk, country, rock, and especially heavy metal. However, the authors stress that much of this research focuses on listeners, often teenagers rather than musicians themselves. Importantly, these music communities or scenes can also offer strong community and belonging, which may protect against suicide rather than increase risk. There are many other genres that scientists need to look at more to understand suicide risks, including K-pop. When the authors talk about why the risk might be higher, they lean on well-known suicide science and show how many risk factors cluster in musical work. A survey of musicians found 17% reported at least one past suicide attempt. A sobering number, even if larger, more representative studies are still needed. The paper also highlights evidence of bullying, harassment, misogyny, and sexual abuse in parts of the music industry, and notes racist abuse too. Add in financial insecurity, common in music careers, isolation and loneliness, disrupted sleep from irregular schedules, relationship strain, physical pain, pressure from social media exposure, touring stress, eating disorders, performance anxiety, and perfectionism, and the author's stacking risk idea becomes very concrete. This is where a Jenga metaphor really fits. Musicians often face multiple wobbly blocks at once. The review brings this to life with chilling examples from musicians who seem to sense the danger themselves. Swedish DJ Avicii, exhausted by touring, is quoted saying, "I have told them this. I will not be able to play anymore. I have said, like, I'm going to die." These aren't neat scientific proofs, but they powerfully illustrate how identity, work pressure, and hopelessness can fuse together in a musician's life. However, the authors are careful not to overclaim. They openly discuss major limitations in the research. Suicide data can be messy, deaths may be misclassified as accidents or overdoses, and the paper gives examples where similar deaths were recorded differently across cases. Another issue is that many studies focus on famous artists because they're easier to identify, which can distort the picture. Fame itself becomes hard to separate from risk, and it remains difficult to define who counts as a professional musician, which makes good estimates harder to work out. So, while the overall signal is strong, the authors are honest that prediction of suicide is poor, and at best is only slightly better than chance. Despite these issues, the authors argue the pattern is clear enough to justify action. They agree that musicians do appear to be an at-risk occupational group, and that prevention efforts need to match the realities of the job. That is why they adapt the Zero Suicide Framework, a structured approach used in healthcare, into something that could fit the music industry, including leadership action, training gatekeepers around musicians, better identification and safety planning, evidence-based suicide-focused therapies, and smoother support during high-risk transitions like touring. The authors are honest that these prevention ideas have not yet been formally tested with musicians. Much of this section is expert opinion grounded in strong suicide research, but not musician-specific trials. This transparency strengthens the paper rather than weakening it, because it clearly separates what we know from what we hope might help. Looking forward, the authors call for better data, especially studies that include fewer famous musicians, women, and non-Western music industries, such as K-pop. They also note that K-pop suicide risk needs careful research because the public focus is high, but musician versus population suicide data in Korea is not yet known. They highlight possible cultural pressures in Korea, like obsessive fandom, cyberbullying, and punishing training schedules. They stress that prevention should not rest solely on individuals being more resilient, but on changing systems that quietly talk about exhaustion, instability, and silence as normal. The review closes with a powerful reminder that while musicians enrich our lives through their art, we have a responsibility to care for them as workers and as humans, not just as symbols. Suicide in music is not a tragic inevitability or the price of creativity. It is a public health problem that can be understood, addressed, and in many cases, prevented.